Hello, I'm Judah Lyons of the Lyons Institute, and I would like to show you how I do plantar fasciitis. The big difference between the way I would assume other Rolfers and people that have been trained in a more global way of appreciating the body and its intricacies is that if you are just dealing with the plantar fascia and trying to change that using mechanisms, and I'm not saying it's not successful, I'm just saying we do it differently or I do it differently, you're missing out, because all these pulleys and levers that attach down here are responsible for this. I don't think it's isolated. I don't think the plantar fascia gets inflamed by itself. I believe, and I have found in my practice for it to be true, if you loosen everything that attaches above the retinaculum here, or essentially from the knee down, gastrocs, soleus, tibialis anterior, peroneus, all the attachments, all the muscles, if you deal with it from here down, you will eventually alleviate the suffering that people are dealing with. So we want to open everything up. We want to get more blood flow. We want to get every tendon and ligament attended to as best as we possibly can to deal with this plantar fasciitis. It's going to create more freedom of motion and movement. The fascia has wrapped in this particular pattern. Maybe it's wrapped like this. So by moving in this direction, you're not hooking in. By moving in this direction, you're not hooking in. But by moving in this direction, you're right on the movement of the fascia, and you can take it and do what you want with it once you're in the movement of it. You can sort of grab it by changing your vector. By the way, this work that we're doing here is pretty much valuable for anybody, regardless if they have a plantar fascia challenge or not. It's just maintenance. We're going to take care of the lower leg right now, and it's it feels wonderful, and it's very important for biomechanics. If things aren't working well down here and this foot isn't touching the ground well and balanced, everything above it's got to compensate.